Hey everybody, Victor here from Cyborg for Life. Today we have a special guest joining us. He is currently undergoing bilateral femoral limb lengthening with the Stryde internal nail. Please join me in welcoming cosmetic limb lengthening patient, Alfonso. Alfonso, how's it going, my cyborg brother? Thanks so much for coming on the show.
No, thank you. Thank you for everything that you do. It's because of you that I had the surgery done, all right? I'm not kidding. It's explicitly because of you.
Whoa. Well, man, I'm to blame, I guess. But yeah, man, I gotta say, you are the man. I know it can be difficult for a lot of people to speak about their journey, especially their leg lengthening journey to get taller. So I really appreciate you coming on, because I know a lot of people are gonna appreciate you sharing your experience, especially since you just got your procedure done in the last couple of weeks, correct?
Yeah, I got it done on May 22nd, and it's actually been pretty great.
Has it? That's
Yeah.
awesome, man. Very cool. So I enjoyed backstory. So I just want to kind of ask, like, when did you first hear about the procedure and the whole limb lengthening thing?
I was like probably like 12 or 13 years old. This was back when like the internet was like a little more like the wild wild west, where like you had a bunch of scams. Like I fell into this like limb lengthening scam where like you gave somebody $100, you PayPal them $100, and they gave you limb lengthening pills.
Oh yeah.
This was back when you had that external fixator, when the technology was still like pretty rough. And so like this is when I'd say about 2005. This is when I first found out about it. It was still a little rudimentary.
Mm-hmm.
So and I was broke. I mean, I was like 12 or 13 years old. So obviously I wasn't gonna be able to pay for it.
Right, right.
But
And
yeah, that's when I found out about it.
you found out about it, and yeah, that because obviously the internal nails came after that and stuff.
Yeah.
Why? What was your like reason behind wanting to get taller?
So I grew up during the 90s. I grew up looking up to people like Michael Jordan, who's like 6'6",
Mm-hmm.
Phil Jackson, who's like 6'5", 6 foot something. Anyway, my heroes were all like super tall.
Okay.
But you know what? Now that I think about it,
Mm-hmm.
you don't need to be over 6 feet tall or 6 feet to be a hero. When I was in the Air Force, when I was in boot camp, my drill instructor, she was 5'2".
Wow.
She was the scariest person that I'd ever met in my life. So you actually don't need to undergo this procedure to be a hero. She became one of my heroes as well.
That's cool.
But that was my main motivation, like Michael Jordan and Phil Jackson, basically watching basketball. I wanted to be tall too, and I got robbed of 1 inch. Okay. Okay. Because I was actually 5'11".
Oh, really?
I got robbed of 1 inch. Damn it.
To break that 6 foot barrier, huh?
Yeah.
So that's how tall you were before you got the procedure done, right?
Yeah.
5'11"?
Yeah.
Okay, very
Yeah.
cool. Awesome. And what were some of your thoughts or aspects or factors that played into your final decision to go through with the procedure?
So the first thing, okay, this is gonna sound dumb. Look, the first thing was safety, okay, and that's smart, obviously, right? So it's precisely why I didn't go to India, or I could have got it done in, what is it, Turkey, I believe, and also in Germany. But obviously, throughout the whole pandemic, it's really hard to travel. But first and foremost was safety. But I want to say that really, really close to safety was the price.
Yeah.
Because
Exactly.
I would just wanted to be able to afford it.
Mm.
And it was actually Dr. Debbie Prashad with Limb Plastics, who has like the most amazing price for this surgery. And I'm not sponsored by Dr. Debbie Prashad or Limb Plastics, and I'm not getting anything from mentioning his name or anything like that. Just like I know how you are independent and you're not affiliated with any of these people.
Right. Yeah. That's
safety, but
price
price
is up
as
there.
well. Yeah,
Those
price.
are the two
Price.
factors. Very cool. And that's two of the main factors. I actually just had an interview with Dr. Paley last week, and he was stressing safety. Safety
Yeah.
is the most important thing. It's like anything can go wrong, and you need to make sure that safety is number one. And obviously, price is going to be in there, but you want to find that happy medium between the two. Very cool.
And sorry,
Yeah,
before you say anything,
yeah.
Dr. D was actually trained by Dr. Paley.
Mm-hmm.
So
Yeah.
he learned under, so he learned through him.
Right.
So I feel like I kind of got Dr. Paley's result, and Dr. Paley, he's the god.
He is.
He is
He's the
the
king.
god
Yeah.
of this surgery.
The upper echelon.
So
He is the greatest. The
yeah,
GOAT.
yeah,
He's the
yeah,
Michael
yeah.
Jordan of limb lengthening. There you go.
Yeah, yeah.
I completely agree with that. He's truly a cool guy. Now, how you mentioned you were 5'11" before the procedure, and you had your procedure done 3 weeks ago. So you've already started your distraction process, right?
Yeah, I started my distraction process, I want to say 3 or 4 days after my procedure.
Okay.
But actually what they don't tell you is that as soon as they put the internal, because I had the internal nail done,
Mm-hmm.
as soon as they put that internal nail in there,
Mm-hmm.
you've already gained, like, I want to say like maybe 1 or 2 millimeters,
Right.
which is nothing. But
Not paying for that.
yeah, but it's a free 1 or 2 millimeters. So since that date, I've actually gained almost an inch.
Wow.
So I'm about 6 feet tall
That's cool.
as of this point,
That's
and my
really cool.
pants are starting to raise up.
Right. You're noticing
So
that. That's awesome.
yeah.
And you said that it was because of your heroes when you were growing up, you wanted to be taller. Um, were there anything besides just looking as because in the world there's two things that we do to the motivational factors. It's going towards pleasure and it's running away from pain. Was there anything that was like nagging at you or gnawing at you that really made you want to do this procedure, or was it just that you wanted to be like your idols?
Yeah, well, I wanted to be like my idols, and looking or thinking about it deeper, I wanted to be somebody that people could like literally look up to. You know what I mean?
Right.
um, because I I personally I want to do great things in life.
Hmm.
And you don't need to be tall
Right.
to achieve these things, but I've always had that that vision of just being this of wanting to be this great person who's tall,
Hmm.
who's looked up to. And
Hmm.
it's a little embarrassing to admit that, but it's just the truth.
Right.
I
Yeah.
just I just wanted to be taller, that's it.
Okay. Yeah, and that's in the I guess that's more of a rare reason, because you hear a lot of times that the majority of people who get this done is because of a height dysphoria or height neurosis. They just feel like society doesn't accept them because of a certain stature. But in your case, you just wanted to kind of like elevate your quality of life a little bit, and I think that's a great way to look at it, because you don't want to just feel like everything is against you. You want to kind of push forward. And let's talk about the procedure a little bit more. So before the procedure, were you involved in any type of physical activity or like athletics or sports or anything like that?
No, I've always
Okay.
sucked at sports. I mean, the last time that I played sports was probably like in 11th grade, and I got a soccer ball like straight to my face.
Ooh.
So no, but aside from that, I was going to the gym a lot.
Okay.
Obviously, I mean, if you look at me now, I got a kind of double chin status going on ever since the whole coronavirus. I've been eating a lot.
Yeah, me too.
But no, as far as physical fitness
Hmm.
is concerned, I was just doing regular exercise at the gym.
Okay.
Nothing too fancy.
Gotcha. And do you have any fears of potentially losing any physical fitness ability when you go back to the gym after the procedure?
Yeah, I feel like maybe it's gonna be harder to squat.
Okay.
I feel like I'm gonna put more pressure on my knees
Hmm.
if I do squatting. So I think that's something that I might avoid,
Okay.
and instead I'll just use a machine which allows me to put more pressure on my heel rather than my knee.
Right.
Um, I know somebody who surfed
Hmm.
who now cannot put his knees under his body
Mm.
to get on top of the surfboard
Yeah.
because they had this procedure. So
Wow.
they've actually lost that ability to surf the way that they used to.
Wow.
So anybody who goes into the surgery, you should understand that you're going to lose some ability because you're actually changing the composition of your body.
Mm-hmm. Right. And how long, do you know how far out from the surgery he is? Like how long ago he got it done?
Oh yeah, he got it done. I want to say about three or 4 years ago.
Okay.
But he says he doesn't regret it. In
Okay.
fact, this guy that I'm talking about, he
Yeah.
was on the show The Doctors with
Mm.
Dr. Debbie Pershad.
Okay.
His name's David. Anybody could look him up. It's
Right.
just The Doctors and
Yeah.
limb lengthening.
Okay. Okay. Very cool. So yeah, that's one warning you gotta, let everybody know. I think, and I hear it's gonna change things. But I think that, like you said, it's like, if it's worth it, you're gonna find ways around that to make it happen or make it worthwhile in the long run. So,
Absolutely.
um, okay, man. So you're a few weeks out from your surgery. I want to talk about the pain of the procedure. So you know, let's talk your mindset going into the procedure. Let's talk those few days. Cause I know you messaged me like like 6 hours before your procedure. You're like, hey man, I'm going into my procedure tomorrow. I was like, holy crap, you are. So,
Dude, I was so excited. So
yeah,
excited.
it was like midnight. I looked at it, I was like, oh my gosh, I'm excited. So, you got to tell me what was going through your mind, and then what was the day like? What was the process like from 6 hours before the surgery all the way through to like the first 3 days? Take us through it.
Okay, so actually it's funny because the night before that I had my surgery, I had a nightmare about
Yeah.
the surgery that everything went horribly wrong. But the thing is that in my mind, deep down inside, I knew that I was in like the best hands possible.
Mm-hmm.
So when I sent that message, the only feeling that I had was sheer excitement that a dream that I've had since I was 12 or 13 years old was finally coming to fruition.
Yeah.
But as far as the pain is concerned, I remember waking up and not being in pain, not being in as much pain as someone would think
Mm-hmm.
after somebody just physically like hammered your bones and like broke them down. It's pretty gruesome if you actually look at the surgery.
Yeah.
But I wasn't in as much pain.
Okay.
And throughout the whole procedure, the doctor has you on this cycle of medications from Dilaudid to Toradol to morphine
Mm-hmm.
to something. It's just a whole cycle of medicines, and it's kind of like muscle confusion. I'm sure that you've heard of it since you're
Yeah.
like kind of like a bodybuilder, right?
Yeah, buddy.
It's just your body is just constantly taking these medications, and the pain is like it's almost not there.
Right.
But at the
Yeah.
same time, your legs,
Yeah.
they weigh like 2,000 pounds.
Yeah.
It literally feels like your legs weigh 2,000 pounds, and it's crazy because you're a buff dude, okay?
Right.
And I bet you can squat a lot, but I guarantee you, if you were to undergo this surgery,
Mm-hmm.
your squatting ability would be nil.
Nothing. Yeah.
Dude,
Right.
it's like all your quad power, all that horsepower,
Is just
like
taken
that,
away, just like that.
gone.
Yep. I
Yeah. So
remember.
that's what the first 3 days are like. Your legs are just heavy and your pain is minimal because of the
Right.
cycle of medications.
Gotcha. And being heavy, I think that, the legs feeling heavy, I think that has a lot to do with the swelling. What was the swelling like? Let's say those first 3 days, was it really, really bad? Were your legs like inflated like crazy?
Dude, I was thick.
Yeah.
I was like Thanos. I don't know if you guys have looked at that meme of Thanos being all thick. Dude, my legs were like fat. Let's say this is my regular thigh, like that.
Yeah.
Dude, I was like this.
Wow.
It made my really loose sweatpants look like yoga pants. Dude, I was thick. Like
That's
real
hilarious.
thick.
Right.
It was
And
incredible.
has the inflammation kind of subsided since then?
Oh yeah, the
Yeah.
inflammation goes away within like, I want to say within about 2.5 weeks.
Okay.
The
Yeah.
inflammation goes away.
Okay.
Yeah, and gradually as your inflammation goes down, your ability to use your quads goes up.
Okay.
Yeah.
Yeah, that makes sense. All the fluid is starting to kind of dissipate, and you get more, use of your muscles and whatnot. Very cool.
Yeah.
what, let's see, now that you had the internal stride nail done, so that's the full weight bearing nail. How
Mhm.
has getting around been since, the surgery? Like, have you been walking around with a crutch, two crutches, walker, nothing? Tell us a little bit about that.
So I actually walk around using one of these suckers.
Okay, got the walker. All right.
Yeah. And it's funny because I tell all my friends and my mom and my professors that I'm close to
Yeah.
that I'm basically an old man at this point. But here's the deal. I definitely recommend the Stride nail.
Hmm.
I don't know what version of it it is,
Hmm.
but I think it's just the Stride
Yeah.
Nuvasive nail, the
Yeah.
full weight bearing nail.
Right.
Because man, you're completely independent.
Yeah.
Like today, I'm gonna go to the gun range and I'm gonna go shooting, and my legs are gonna be perfectly fine.
That's crazy. That's so
Um,
cool.
I go grocery shopping. I'm fully independent. I
Wow.
don't need anybody.
That's so cool.
So for
That's
anybody who's going through this procedure, I definitely recommend
mm,
that nail because
right.
dude, you're not gonna need anybody for this. This is like completely lone wolf solo status.
Yeah.
If you want.
Right. Yeah, and I think that that's one of the biggest advantages of the stride now. It's like and I think that's why it's catching on a lot more. Dr. Paley said this in his interview: is that this surgery would not have caught on as well as it has if it wasn't for this advancement, where people
Mhm.
could do things that were independent, where they could go out and do, live their life, and again, not like live perfectly normally, but they could do things a lot more independent, not having a caretaker or not having to have full crutches or wheelchair all the time. So that's huge. Um, what let's and you said, you before we got on the interview, you said that you just finished physical therapy today, right?
Oh yeah, yeah.
Yeah. What's PT been like for you?
So PT, they have me doing kind of like a leg presses,
Okay.
a bunch of like a lot of exercises which deal with proprioception,
Mm-hmm.
being able to like mentally place your new limbs, basically where in a correct position.
Mm-hmm.
the the exercises that they have you do are a bunch of range of motion stuff, maybe a little bit of stepping,
Mm-hmm.
um a lot of stretching,
Yeah.
a lot of like it's a bunch of stuff that you normally wouldn't do at a regular gym,
Okay.
aside from the leg press.
Right.
And it's not painful
Mm-hmm.
during it. It
Mm-hmm.
really isn't,
Okay.
especially because of the medications that you're under.
Right.
But after
Yeah.
PT, dude, that sucks. Your legs are just like you're just in your car, like, oh my fucking God. Sorry,
I know you're good.
excuse my French.
You're fine.
I hope you bleep that out.
You
But
know.
yeah, you're like, oh my God. You're just like touching and like rubbing your legs, like, what did I just do?
Yeah. It's
But that goes away.
right. How many hours after would you say that it kind of fades away? A couple hours?
I want to say about 30 minutes,
30 minutes? Okay, yeah.
but
That's
everybody's different. So
right. Right. Yeah, no. I mean, when you're lengthening, obviously you're stretching all kinds of soft tissue, muscles, ligaments, tendons, and that kind of needs to get that recoil and kind of dissipate a little bit too. It's just like a workout. You're stretching, tearing up fibers, and rebuilding. So,
yeah.
so getting around, PT's been good. How about taking a shower like after the procedure? Because obviously you have those incision sites. What's that like? Getting water and getting wet.
Okay, so what I'm doing right now is basically taking a military shower, which is basically you take a wet rag and
Yeah.
you wipe down all the everything that you possibly can get wet, or
Hmm.
that you can possibly get dirty that you want to clean up.
Hmm.
I don't get water anywhere near the tiny little incisions, and dude, it's crazy.
Yeah.
These scars that I have,
Yeah.
they're not even scars. Like
Yeah.
within a year, they're gonna look like nothing.
Right. Right.
Um, but as far as showering is concerned and hygiene, that's just the way that I do it. I sit in my on the edge of the tub,
Hmm.
and I scrub myself,
Okay.
and then I'll step out,
Yeah.
put my hair under the water, and then just shampoo
Okay. Gotcha.
and stuff. So it's really not nothing special.
Right. And have you gotten your sutures removed yet? Like for the or like the not sutures of the tape that they put on, have they taken that all off? Yeah.
Yeah,
Okay.
yeah, it's completely off.
Gotcha. It's all off now. Gotcha. Because, and when did your doctor say that you can start to take showers?
Man, honestly, I forgot.
Yeah.
I should text him right now.
Right. And find out.
Well,
Yeah.
hey man, can I take a shower today?
Yeah. Because I think for me, it's been 8 years since I got it done. I think that it was just about a month. They wanted it to close up. They didn't want the water getting in there. So, but I use a shower. What do you call it? A shower where, like you shower bag kind of. Yeah. Where you kind of pull it over the limb, and
Okay.
you can do that. But obviously you have femurs done, so it'd have to be the full leg, and that would be a lot more inconvenient. So I had the tibial done.
You got 2 inches, right?
Yeah, just about 2 inches. It was about 4 centimeters or so, and it was yeah. So, and it wasn't as much length as you're getting, but it was on the tibia. So, obviously, that leg being lower, I could have just put the bag over it, and it was a lot easier to kind of do that. So I could just sit on a shower chair, clean up, and then get out. So,
Well, what I found that most amazing was that with the amount that you gained about 2 inches, which is pretty much what I'm looking to get, somewhere around there, maybe just a little more.
Yeah.
I found that like I saw a video of you sprinting, I think.
Yeah.
And dude, like the way that you sprint, it looked perfect. It's like your ability wasn't really affected by it.
Right. I think that really depends on the person, and also, like you said, you're just in the start of your process. I think as we follow your story over the next year, and we just kind of keep talking to you and stuff like that, and you get back your muscle strength and your ability, you're going to be surprised. You're going to be surprised, especially if you don't push the full, when you stretch the full length of your maximal flexibility, that's where things get a little challenging. But it's always my belief that even if things change, you can always work harder in a different direction to get where you want to be. And I'm actually trying to revamp a program with other limb lengthening patients to help them, excel in terms of their athleticism, but that's in the future. But I will be keeping in touch with you about that.
Dude,
So.
I'm all in. I'll take my money.
It'll be free for a beta, and then we'll talk about money. But Alfonso, we gotta talk about proportions, because I get this question so much. In fact, I've gotten it probably 5 times since we messaged the other day. Were you ever worried about throwing off or skewing your proportions between your 2 legs? Like, you're getting the femurs done. Obviously, it's going to make your femurs longer than your tibias. Do you care, or does that bother you, or did that bother you, or what's your thoughts?
Well, your femurs should be longer than your tibias naturally.
Right.
So actually, I measured my femurs, and I measured my tibia, and obviously my measurements are not, they're not the X-ray type.
Right.
So they weren't perfect, but I measured my femurs and my tibias to be about the same, which is not proportional.
I gotcha.
But in terms of, let's just say that you're proportional. Let's just say that you're a normal human being. Am I worried about my proportions being thrown off? Yes.
Okay.
But the thing is that I've researched this a lot. And I've looked at every single patient who's had about 3 inches done. They all look completely normal.
Right.
You can't tell that they've ever had this surgery.
Yeah.
It's mind-boggling. You would think, 3 inches, which is a lot for someone to gain.
Right.
It's a lot of bone to fill in. But you can't tell. You can't tell whatsoever. It's incredible.
Yeah. And no. I completely agree with you. I think that there was actually a video that I did maybe a week or 2 ago on proportions, and it was basically saying that male attractiveness is actually it's more favorable to have longer legs. And not only that, but I've talked to other experts, Dr. Rosbrook, Dr. Paley, and so on, and they're saying that the femurs, if you lengthen that, primarily you're going to cover that up with shorts if you're a guy. And having longer femurs, like you said, they're supposed to be longer than your tibias. It's hard for people to know. And if they do look a little longer when you first stop, when you first get your length and you get out, give it a year or so. When you start to fill in with some size of muscle mass, it'll kind of give that illusion of not looking as disproportionate. So there's always ways to work around it. So it doesn't bother you anymore, though.
No, but you know what? I've actually just started thinking about this. As your femurs are being extended, that amount of muscle, it's kind of shrinking, right?
Yeah.
It's kind of gonna make it look like I skipped leg day every single day, and I already have skinny legs, so it's not helping.
I see. But the nice thing the nice thing about that is that it actually does create new muscle in there. So you actually have a chance for those legs to get bigger over time. Not going to be like for the first year or so, but like give it 2-3 years. Because I noticed my calf when I did that, it's bigger on that side. Then I had to train the other side. So it's very, very cool that you made that point. So we talked a little bit about PT. You said it wasn't as painful more so after it. Are you doing anything extra when you get home?
Yeah. Oh,
Okay.
yeah. Whenever I'm in bed, I
Yeah.
actually do. It's kind of awkward for me to show, but I basically get laid down, and I have like basically a fetal position.
Okay.
I open up just one leg at
Uh-huh.
a time,
Clamshells.
like an
Yeah.
abductor,
Right.
and I do it on both sides just so that just so I can get that strength back. And I constantly try to squat
Okay.
out of a chair and
Right.
into my walker.
Okay.
I basically use any opportunity that I get to make an exercise out of any movement, just because I want to regain my normal abilities.
Mm-hmm.
Um, so that's as far as that's as much as self PT that I do. I walk around the block,
Okay.
but that's sometimes I've actually injured myself
Really?
because my body's not ready
Right.
for that much physical activity. So that's a warning for you guys um, who undergo this procedure.
Yeah.
You may be ready to walk mentally. You may be ready to
Mm-hmm.
walk around the block, but physically, you may hurt yourself.
I'm glad you brought that up because a lot of times this stride now being as strong as it is and allowing full weight bearing, there's still that caution you have to take. And it probably won't give or anything like that, but you just don't want to take the chances. And,
Yeah.
there's a lot of soft tissue that can, have issues, not so much the bone itself, but like the soft tissue around it. You can tear things and can hurt stuff. So I'm glad you really brought that up for people to pay attention to. So what about preparing for the surgery? Did you do anything before, like stretching before, or did you kind of just like, hey man, yippee-ki-yay, let's get this done?
Okay, so actually, I did a lot of walking. I did a lot of long distance walking. So I walked about 5 miles a day for about 2 weeks,
Mhm.
and I did all the stretches that Dr. Debbie Prashad prescribed for me to do.
Mhm.
So I stretched a lot and I walked a lot. Um, but that was pretty much it. I didn't really do any. I couldn't go to the gym just because the bug, the bug
Oh,
had already hit.
coronavirus, yeah.
So I mean, I guess I could have squatted at home, but I'm just
That's very cool. Awesome. And let's talk about sleeping at night. A lot of people are worried about is the pain going to be aching and keeping them up at night? What has your experience been with taking naps, sleeping, resting, or just sitting there while you're trying to study for the MCAT because you're trying to become a doctor? What has your pain been like throughout different phases of the day?
it ranges from like a 1 to, I want to say, maybe a 6 or a
Okay.
7.
Okay.
And the reason why I say that is because when you're under the medication, the
Mm-hmm.
medications are powerful.
Right.
They work.
Yeah.
For some people. For
Right.
some other people, they may not work as well. Um, but the pain can actually increase as you're lengthening, as you're using that external remote control, that device that lengthens your leg.
Mm-hmm.
As you're lengthening, you're stretching a lot of connective tissue, a lot of nerves, a lot of muscle.
Right.
And so from there, that's where a lot of my pain actually comes from.
I see.
So it kind of makes it hard to concentrate. It does make it hard to go to sleep.
Mm.
And something that people should know is that it's you're not just going to go from gaining 1 inch to gaining 2 inches
Mm-hmm.
to possibly gaining 3 inches.
Mm-hmm.
As the amount of lengthening increases, so proportionally will the amount of pain
Mm-hmm.
that you incur. So that first inch that I've gained, or that I've almost gained,
Mm-hmm.
I'm just now at the cusp of gaining just a little more pain.
Right.
But as far as sleeping is concerned, man, I sleep like a baby. Uh, But for the first 3 days or for the first week, I want to say,
Yeah.
because I'm a side sleeper.
Okay.
Those nails that they put on you,
Yeah.
you're not going to be able to sleep on your sides. You're going to be sleeping on your back, and you're going to be waking up every single hour.
Mm-hmm.
But
Yeah.
luckily, they give you a lot of drugs. So
Right. Puts you out pretty well. Yeah, I actually, I remember I'm working with another guy who's getting it done in Florida. And I know that he actually started before the procedure to start to train himself to sleep on his back so that, he knew that you're not going to be able to sleep on the side. So he was able to start to fall asleep on his back, and it helped out with that. Obviously the pain can affect. And like Alfonso said, the more you stretch those soft tissues, you're going to feel more of a stretching, dull, aching pain. It's probably not as bad as like right after the procedure, but it can definitely, you can feel it, right?
yeah, definitely. Yeah, and a lot of the pain is actually, it's funny, it's mostly in my knees.
Interesting.
Yeah.
Where in your knees? Is it more like near the patella, or the lower of the knee, or the upper near the femur?
Look, you're the doctor here, okay? So let's let's pretend this is no. Okay, hold on. Okay, so here's my knee.
Yeah.
I'd say the pain is somewhere around here.
Okay, lower knee near the tibia. Okay. Yeah.
And by the way, look, do you see how easy it was for me to get up from
up? Yeah, it's amazing. I wouldn't have thought you had this surgery done. So cool, man. So cool to see you moving around like that.
Yeah.
That's awesome, man. Okay, so what was your energy levels like after the procedure? Were you exhausted like the first few days to the first week after? Did it get better, or do you feel like an energy drain just from the procedure still up to this point?
I didn't feel an energy drain whatsoever, and maybe this is something, it's different for everybody. Obviously, you're going to be cycling, they're going to be giving you a bunch of drugs, and my strategy throughout the whole thing to keep my energy levels up was, as soon as they gave me the drug, boom, fall asleep. Just turn off the TV, turn off the hospital TV, fall asleep.
Right.
Wake up, and then use your arms to mobilize your legs, to start moving your legs, to make them, to stretch them, to because you don't want to just have them in one position throughout the whole time. So every time they gave me a drug, my whole deal was fall asleep immediately.
Okay.
Then wake up, mobilize my legs, keep my and that energized me.
Okay.
And so by staying engaged and using that cycle of drug, sleep, then exercise, drug, sleep, then exercise.
Yeah.
Dude, it didn't drain me. I felt fine. I could have studied. I could have done whatever I wanted to do.
Wow, that's super cool that you have like a little routine, like that little regimen that and that's what I think everybody has to pick up here, is that, there are certain things that, across the board are going to work for a lot of people, but when it comes down to it, it's individual. So you have to kind of figure out what works for you, but you came up with something like that. It's like, use the drugs to fall asleep because it's going to be hard to fall asleep. Wake up, and then, you're going to be stiff when you wake up. So to get that blood moving, massage those legs, get that, super, super cool that you brought that up. Awesome. And that you said, when you're trying to read or something like that, let's talk about your detailed oriented tasks like reading, studying for your tests, watching a TV program. What are like the focus levels? How is your focus affected, whether you're taking the drugs, off the drugs, trying to read? Tell us a little bit about that.
So with the drugs, it's incredibly difficult to do any kind of detail oriented tasks.
Okay.
Like even just me texting somebody, I tend to like miss a lot of letters, and a text that would normally take me like 5 seconds to send can take me like 2 minutes, just because I'm missing so many letters. But I get around that by taking caffeine, not pills, but like, I'm not sponsored by G Fuel, but that's what I drink. It's cheaper. Than go to Starbucks. So it is difficult with the drugs just because they do sedate you, and I'm not gonna lie, any detail oriented task, it's gonna be difficult to do. But coffee is always the thing, so that'll help.
Yeah, I think that's one of the biggest things, is that finding, whatever nutritional supplements and stuff. And that's kind of what I want to get into now, is what besides your caffeine to help with your focus, what other nutritional, things did you implement, like vitamins, your food, or things like that to help you?
I'm not sponsored, okay? Look,
Yeah.
I'm not sponsored by anybody, but my doctor prescribed me this right here,
Okay.
Pure Synergy Bone Renewal, and I maybe he has a stake in this
Yeah.
company.
Yeah. Yeah. That's why I pushed the product on you.
Yeah.
What does it have in it? Is it some sort of special calcium?
Yeah, so it has vitamin D, and this vitamin D3 is fermented.
Right. Okay.
Uh,
Yeah. What's
so
the IU on that? How many IUs?
2000.
2000. Okay.
So it's
How many
about
times you take it?
500.
Only once a day?
You take it twice a day.
Twice a day. Okay.
Yeah, and it's got vitamin K and it's got calcium. It's got 80% of your recommended intake. But aside from this, I also take calcium tablets.
Okay.
Um, so yeah, so it's this bone renewal supplement and also these calcium tablets from Walmart that I take as part of my. I mean, aside from caffeine, to
Right.
supplement this.
Caffeine's number one, huh?
Oh, yeah, big time.
He should be sponsored. That's what he's saying. Very cool. Yeah, and I think that that's super important. Like for me, when I was down and I was making this program, I came up with like all the supplements and stuff that I thought were good for the joints, good for like the calcium.
Oh, yeah.
Yeah. And I'm gonna try to do a video on that in the next. I got to check my schedule. I think in the next couple of weeks, I'm gonna try to get that out because I know a lot of people are gonna get back to the surgery. So,
Yeah, that'd be cool.
yeah,
I really like to know about the whole joint thing because
yeah,
that's gonna be something for the future for me.
it will. And I think that certain things, obviously think people think glucosamine, chondroitin, MSM, those are the top three, but then obviously what doses do you need? Is there anything else in there? Anti-inflammatories. And then you got things like vitamin D. What's the max dosage you can take before it becomes toxic and stuff like that? I was pushing almost 10,000 IUs a day, being a bodybuilder and needing testosterone, being a man. So there's a lot of different things. Do you take, what's that?
Okay, so there's a prescription bottle.
Yeah.
Okay. Okay. It probably doesn't have a lot of identifying information,
Right.
but so I don't know if you can see, but they prescribed me 50,000.
Is that IU of vitamin D?
Yeah,
Wow.
50,000 IUs, but it's once per week.
That makes sense. That makes sense. Yeah.
And
Especially
dude, when
since,
I saw that, I was like, dude, they're trying to
yeah.
like they're trying to assassinate me. They're
Right. Yeah.
my money, and then
Yeah, being a pro hormone like that, the vitamin D, usually if it gets really toxic, your body will pee out a lot of it, but it can. But they know that you're going to be indoors, you're not going to get a lot of natural vitamin D, but it's super important. Vitamin D3 is probably, believe it or not, more important than just outright calcium. But we'll talk more about that in the next video. But uh, what was so before you made that final decision, what was going through your brain before you said, okay, I'm gonna go through this surgery, I'm just gonna do it? What was going through your mind? What was like, hey, maybe I shouldn't do this, or you know what, I got one life, I just got to get this done and get my height and live a happier life? What was going through your brain there, Alfonso?
I was just thinking about the benefits. I was just thinking that, like, man, it's gonna be so cool to be, like 6'1" or
Yeah.
6'2".
Okay.
That's all that I was thinking about. Like in my mind, I was like so convinced
Yeah.
that I was in the hands of a great surgeon because he had already published a lot of great results,
Mm-hmm.
and he had worked under Dr. Paley, which is
Right.
the greatest of all time.
Yes.
So I wasn't scared or anything. Like going into the surgery, I knew that I was in the best hands. Um, I had, like, I'm not kidding. I had complete confidence. In fact, the only thing that I was thinking of was this show called Dexter that I just started watching before the surgery. That's all I was thinking about. Just because, like, in my mind, I knew that I was gonna go in, get my surgery, within 1 hour, be done, wake up, and have full weight bearing nails,
Wow.
and be able to go buy groceries, go buy this, go do whatever I want.
That's crazy. So how long did your surgery take?
It took about an hour and about 15 minutes.
Okay. Gotcha.
Yeah,
So
it
it
was
wasn't.
pretty fast.
Okay. And you mentioned you were thinking like you were 5'11" to start, 6'1" to 2 inches. Are you considering going for the full length, or do you think that there might be some sort of hesitation at the end, if you feel?
Yeah, I think that I might stop at 6'1".
Okay.
So I'm at 5'11", so I can gain up to 3.15 inches.
Yeah.
But I think that I may stop at 2 inches,
Okay.
just because, look, there's there's something within me that within me that says, could I do it?
Right.
And the answer is yes.
Mm-hmm.
Should I do it?
Mm.
The answer for me is no.
Gotcha.
Um, I would love to be, 6'2".
Mm-hmm.
But the thing is that I feel like if I get that extra inch, and I
Yeah.
know that it sounds like, hey, it's just an inch,
Right.
dude, you can lose a lot of mobility of function if you do that. So I'm more comfortable with 2 inches. And I
Mm-hmm.
know it sucks because it's like, hey, you just blew a lot of money just for 2 inches, but those are 2 inches that mean a lot to me.
Right.
So I'm,
Yeah.
I'm happy.
Yeah, I can completely, sympathize with you there, because I know getting 2 inches or close to it for myself can change the game. Like it just, it doesn't necessarily, even like me and Dr. Paley were saying, is like, it's not necessarily the height that people are after. It's what the height can do for you mentally. It kind of
Yeah.
flips a switch where you say like, that kind of turned off my craving for being a little taller. And everybody would like to be a little taller than that, but you said it, safety matters most. It's like, how much can I get safely without impacting my life, my mobility, and my future, essentially? But you'd still be taller. I mean, 2 inches is a lot, so that's really cool, brother. Do you have a support system in place? Does anybody know you got the procedure done? Are you ashamed? Did you not tell anybody? What's your support network look like?
So I told my family, everybody that I know who is close to me, they know that I got the surgery. They knew before the surgery.
Right.
My mom, she hated the idea. In fact, she was pissed that I was even gonna go through with it.
Right.
She was like, "No, don't do it." But at the end of the day, you only have one life to live.
Right.
This goes back to the last question.
Yeah.
You only have one life to live.
Mhm.
You got to be happy. Of course, she was worried just because of like the long-term effects, which are totally going to happen.
Yeah.
But having a support system is so important, because it's a tough surgery.
Yeah.
This isn't like a rhinoplasty getting it. This isn't like a nose job. It's nothing like any of those other cosmetic surgeries. This is your legs that we're talking about, and you are going to be not in a lot of pain, but you're going to be in constant pain.
Mm-hmm.
Get a
Yeah.
constant 4, constant 3, and if you don't have a support system there to help you out whenever you're feeling down or depressed,
Mm-hmm.
it's going to be really, really hard. So you definitely need a support system. I wouldn't do this without a support system.
I'm so glad that you brought that up, because that's one of the reasons why I'm pretty much doing this whole, video blog thing, is that I want to publicize the procedure a little bit more. I don't want it to be a stigmatized procedure and people to look down on it. That, I understand for like privacy reasons, whether it's work or, if they're in the military or they don't want to tell the whole world, that's fine. But I think that telling the ones that are closest to you and keeping them in the loop is that it's important, like you said, because and if that person doesn't want to, tell their close ones, they can tell people like us and the, Cyborg Nation. I really want people to realize that there are people there for them, and
Yeah.
because this is a lonely surgery. It's a lonely surgery. I mean, literally, you're locked away for almost, a quarter of the year, 3 months, depending on how much length you're getting, and to do that without telling anybody and then coming back out into society, it's like, okay, my close ones are going to probably figure this out anyway. What do I tell them? What kind of excuse do I come up with?
Look, I'm so glad that you said that, because I heard the most saddest thing when I was in the hospital. This nurse told me that she knew a patient who had undergone this surgery.
Yeah.
This patient said that he was going to completely disconnect from all his friends, from everybody that he knew, and he was only going to make new friends after he gained all this height.
No way.
And the reason for that was because he was so like ashamed that he would even that a man would would feel insecure enough to have to undergo the surgery. He
Mm-hmm.
was ashamed that he was even undergoing the surgery. That's so bad. That's so, like, that's totally not like it's not a good feeling to have. Like, you should be able to put down your armor and say, hey, you know what, I think this is a surgery that I really would like to have.
Mm-hmm.
I think it's something that will benefit me in
Mm-hmm.
so many positive ways.
Yeah.
And it's so good to have a support system because, hey man, it's going to be difficult for you to sit down
Mm-hmm.
and eat and then get up from your chair. Like, your legs, you're not going to have all that power to go up and easily put down the dish over there, wash it, and do X, Y, and Z.
Yeah.
It was just a sad story for me to
Yeah.
hear that this guy was just going to disconnect from this his basically his old life and
Mm-hmm.
and rebrand himself. It was so sad. I mean,
Yeah. And I read a lot of those, stories like that, and that gets to me too. I was like, that's why I wanted to start this as a community, of lengthening. And as time goes on, I hope that it becomes more publicized, that people are going to get this surgery done regardless, whether I do this or not. I just hope that they can do this and realize that there's people there for them, that can understand them, and that they don't have to keep it in the shadows anymore. That they can, say, hey, look, I really want to get this done because of such and such. Either in your case, that I want to be taller and improve my quality of life, or I feel like I have people are always getting on me about my height, and I want to improve that. So whatever your reason is for getting it, you want to include people who are closest to you, if they're in your life, to take them along for the ride. So I'm so glad you brought that up. This is great, Alfonso. I think this is going to be helpful, and I'd love to follow up with your story in the future. But do you have any last words for anybody who's thinking about getting the limb lengthening procedure done?
Yeah, so I feel like this is a surgery that if you want to do it, you have to do it for the right reasons. You have to do it not because of some chick on Tinder saying if you're not over 6 feet tall, swipe
Right.
left or right or whichever
Yeah.
direction.
Mhm.
This is a surgery that you need to look inwards and ask yourself, is this something that I really, really want? Because if you look at videos of these surgeries,
Mhm.
you're gonna look at the comment sections and you're gonna see a bunch of people bashing men for wanting to willingly break their legs to
Right.
grow a few inches taller.
Yeah.
Whereas for women, they're congratulated for getting breast implants or getting a tummy tuck. Where you see what I'm saying? It's like
Yes.
while women collect praise, men get lambasted
Yeah.
for wanting to be taller. So I
Right.
feel like this is a surgery that you need to look inward in yourself and ask yourself, is this something that I want to do? And do it for the right reasons. Do it for yourself.
Mhm.
Don't do it for this vapid woman uh,
Mhm.
who is very superficial about
Right.
height.
Yeah.
Look inward and go for Dr. W. Prashad in Lymplastics.
There you go.
Yes.
Yeah. Had to plug that one, huh?
Had to.
Very cool.
Yeah.
Well, Alfonso, thank you so much again for giving us your time to explain your limb lengthening journey. I think it's going to help out a lot of people, answer a lot of questions, and I would love to keep in touch with you, and maybe even have you come on a live session with either me or maybe I'll do a three-way with me and Quay, who's also a limb lengthening patient, just to kind of build that community, have people who have these pertinent questions. Again, I know you have a busy schedule studying for an exam, but we'll reach out and see if we can link something up. I think it'd be cool.
Yeah, absolutely. That's cool.
All right, everyone, that is cosmetic limb lengthening patient Alfonso. Alfonso, we're going to try to keep up your story and follow you on your journey to see how your process and your recovery goes. Thank you so much for giving us your time, and look forward to hear from you in the future, brother.
Victor, I want to say thank you for making these videos and giving me the strength to undergo this surgery. And also to the viewers, you guys are awesome. You guys are a great support system as well.
Mhm.
And thank you for inviting me. And I hope to do more of this with you. And if you guys ever have any questions, please reach out to me.
Hope you enjoyed the interview with Alfonso. It's really great to see people who are getting this surgery done willing to share their story with others. I hope to follow up with his story and share that with you when that time comes. Until next time, this is Victor from Cyborg for Life, signing out.